Welcome into Caldwell County today. I'm Eric Stafford, and joining me today is a special guest from AMOREM, and that is Anna Blanton. And Anna is here. She is the Chief Clinical Support Services Officer.
That's right.
That is a title. That is a title and a half. And you're here to talk to us about November and what's coming up in November for AMOREM.
Right. So I'm glad to be here. Thank you for having me. It is my inaugural appearance on the show. So I'm glad
we hope you come back. We hope we don't scare you too bad.
Yeah, this will be great. I'm glad to be here. So November is National Hospice and Palliative Care Month. And that is why it is really timely that we're here to talk about kind of what AMOREM does for our community, what that month can mean and what it can look like, and then how we can connect people back to some of our services.
Oh, okay. And so remind us again, what does AMOREM do?
Yep. So AMOREM is a leading nonprofit provider of hospice and palliative medicine services for this area. So we serve 12 counties in the foothills and up into the high country. So any patient or family that lives in that area is somebody that we could potentially care for.
Okay. Now, when you talk, a lot of people think of, the end of someone's life when they think of hospice and AMOREM, and they think of that. But the palliative care is what's interesting to me because it's something people don't really think that much about.
Sure. So palliative medicine is more of an upstream level of care. So it's for folks living with serious illness, serious chronic illness. Maybe they're getting treatment for a condition that requires multiple specialists, and it is really for a symptom, for symptom management. So it's earlier intervention at an earlier stage of disease than maybe your hospice would be. It's an upstream level of care, and it can help connect you to us as an organization if you were to need hospice further down the road. So it is an earlier intervention. We have 7 or 8 different nurse practitioner providers over that program. They do still visit patients in their homes. So they do some inpatient consults at our local hospital systems. They do home-based care and long-term care. They just serve patients at an earlier stage of their illness.
Yeah, and my dad went through that, and he had hospice nurses coming, or AMOREM nurses coming to see him, and then also counselors and talking to him and see how he was, just how you doing, how's it going, and that was always great, and it was a welcome thing, and he looked forward to him coming to the house, coming by the house, and seeing how things were going. So that's cool. But November is the National Hospice and Palliative Care Month, so we want to kind of celebrate that. How is AMOREM? Are you guys doing anything special for that, or?
So I'm not sure exactly what all we have going on. One thing I think that really I look at from my background and perspective on a month like this is really the awareness it can bring. Yeah. So it helps start the conversation earlier. It helps us really be an ambassador for this resource as a care program. I think that hospice and palliative medicine is hard to conceptualize for people as kind of a model of healthcare, but it's a really unique model, just like what you described with your dad and his experience. We do things very differently than a lot of other healthcare kind of models, really. We're not just like going to the doctor's office. We're not the hospital. We're bringing care directly to people in wherever they call home. And we do that at just different stages of their illness. But I think that November, as the National Hospice and Palliative Care Month, is really an awareness campaign too. So celebratory because they exist. It's a great service. It's a really important, healthcare entity, but also just bringing awareness to the general public of what they can maybe access and if they really could benefit from care.
Well, and it's like, that's why I described the palliative side, or what happened with my dad was because a lot of people don't know that it exists. Right. Now, one of the things that they're celebrating is that they're calling this month I guess the theme for it is called "We Serve the Whole You." So that's like everything about a person.
That's right. And then that's one of the unique kind of characteristics of hospice as a care model is we try to take care of the whole person. And the whole person means your physical needs, your medical needs, your emotional, your spiritual. When you talk about the counselors coming to serve your family, that whole psychosocial, emotional, spiritual combined element of what makes a person themselves.
Yeah.
And then the medical, physical, personal care, those type things. So we really try and address the whole person, the whole picture. And I think it is a very appropriate theme for the month of awareness, is that hospice is really a care delivery system that does that.
And with my dad, like speaking about the social worker that came by, he didn't know I went to school with her.
Oh.
And we were friends, and we would see each other out and about, and so he would see her, and he didn't think, anything about us being near the same age. He was older, and he wasn't thinking about that. But at the same time, I would see her, and she'd say, your daddy's doing pretty good. He's doing all right. She would, but she would see me in the grocery store or something and say that, which was always kind of cool. But it is amazing, the care team that you get from AMOREM and the folks that are there. Now, so you guys do have care teams that look after folks.
Sure. So essentially every patient that chooses to be on service and we provide care to them, they're assigned a primary care team of professionals and clinicians. And I don't know if you wanted to list everybody that's involved in that.
No, that's up to you.
It's interdisciplinary, so that's one thing that makes us unique. So it's we have CNAs, nurses, social workers, chaplains, volunteers. Then the medical oversight is provided by physicians. We have NPs that we can consult with, so nurse practitioners. And it really can be as few or as many of that combination of clinical disciplines as needed to meet the patient and the family's needs. And so it can be unique and individualized per patient, per situation, based on really where their family's strengths are versus where their family really needs help to benefit the patient, to give them the best care experience possible.
Yeah, and you talk about the medical team, and my dad loved it when Chuck would come by.
Everybody knows Chuck.
Everybody knows Chuck.
We know.
Everybody in town knows Chuck.
That's right.
Me and my wife were getting flu shots at the pharmacy, and we saw Chuck, and it was like, hey, we're getting our flu shot. So
that is something unique about our kind of hometown teams, is that they really are connected to the community, and that is what is unique about AMOREM as this local nonprofit hospice, is that these are folks that were at some point in their life impacted by the care that we delivered at any stage of kind of our new brand as AMOREM or Legacy Caldwell, Legacy Burke. Our teams are made up of members of the community, and they give back to the community through these professional roles that they're in to caregive for people at this stage of life. And it can bring a lot of familiarity and a lot of comfort. It can feel like you're running into a neighbor or a friend, and that can really help normalize or ease some of the anxiety that folks have about receiving care. When you see somebody that you know.
Not only are you seeing friendly faces that you know, but then you guys have been expanded more towards the high country, like you were talking about earlier with the high country, and which is really cool because they didn't really have that until AMOREM started reaching out into that area.
I think that the access to folks in the high country has been tremendous. I mean, we've made some really important partnerships with other organizations in the community there, but bringing this access to care is one of the real values of this community-based model of hospice care that everybody did so well for so long. It's just getting into those smaller pockets of communities to really create access. These are rural communities. It can be hard to get people out of their homes into healthcare settings to receive care timely, and what our teams do is, it is at a later stage of disease or illness, but we get out and we care for them in their space that's comfortable. And we feel we're really compelled to do that well and do that with a sensitivity, because we're being welcomed into folks' homes. And that is a real kind of intimate and personal thing. But we build such a trust with the folks we take care of through these relationships and through this really individualized strategy that it is. That's one of the most rewarding parts about this work, is getting to care for folks and see their home and get to meet their family and do that in very rural areas.
Well, and everyone that I've met with AMOREM, it is a calling. It's like a calling. It's almost like a ministry or something that you feel like, you're helping the public. It
really is. I kind of look at it, it's, a public health campaign, it's a ministry, it's a calling, it could be a variety of those things. And most folks that you see do this work have a personal experience. Whether they share that or not, that's their business. But they have found their way through loss, to give back and to try to do this. And we have really qualified professionals. We have professionals who've received a lot of specialized training to provide care at this stage of healthcare. And so it is not just a run-of-the-mill thing. You know, there's a real technical specialty to a lot of this work that people have training to do so that they can deliver the best care possible.
Yeah, and AMOREM always does. And it's if you've had a family member and gone through this, I've had multiple family members that's gone through AMOREM, and it's like it's amazing the care that they do. Now, does each patient have their own individual plan?
They do. So essentially, when we go out and we get to meet with patients and families, when we start to explain our services, we start developing at that time, in real time with that patient and family, what are their goals? What are your priorities? What's most important to you? Then we tailor our approach to what those needs are. Yeah. So we look at what those families' strengths are, what they have capacity to do, what they have the knowledge or health literacy to understand. We try to bring things in that help them understand what's really happening. We try to bridge some of that communication gap that we see too in certain healthcare settings. Maybe they don't feel fully informed of what's going on with them. Yeah. Our teams come in and help really make sense of that. And so every patient we take care of has a unique plan that's really specific to them. And we use as many or as few of the clinical team of professionals to really accomplish what their goals are.
Yeah, and that's so great that they're able to do that, to just come in and analyze and see what's going on with each person's individual needs. So if you want more information, where can you go?
We have a lot of great ways to access information. We have our website as amoremsupport.org. We have all of our social medias. We have a general phone number. Our phone number is 828-754-0101. You can contact that number and ask for resources all the time. We do have folks that drop in. We have various locations in different places. We have folks that walk in and say, you took care of somebody in my family years ago. I just am dropping by because I think I need help. And we will find a staff member to address those needs and get more information and try to connect those folks. So we have less foot traffic post-COVID. There's just not as many folks out stirring around, but it really is a community-based approach. That's what we want it to feel like. You can walk through the doors and access help if you need it. And we're not just one place. So that's a common misconception for hospices, right? Is that they're a location or that we just have brick and mortar. But really, we bring care to folks in their homes. So we are caring for folks in all settings: long-term care, homes, different care centers, hospitals, and then our brick and mortar buildings throughout the different counties we serve.
Yeah, and it's a lot of counties. I mean, once AMOREM came together, it's a lot of counties. Yeah. And but if you want to volunteer, you can also go to those same places if you want to help out, and that is what's the website again? AMOREMsupport.org. There's a great form on our website if you're interested in hearing and learning more about volunteer support.
Really, nonprofit hospices and community-based hospices are founded in that spirit of volunteerism. So if you look back at the history of hospice in America and how things really developed over time, even our local hospice here, as AMOREM now, started with volunteers who were really inspired to care for folks who were dying. And we still have a great group of volunteers. We have a great volunteer services program, and we welcome you if you're interested and have the time and capacity and the interest to talk more with us about that. We have some specialty volunteers that we also do recruitment for. So licensed cosmetologist, licensed massage therapist. If you're a veteran, we have a unique and special interest in having veterans to support our patients that are veterans. Really, we can find a purposeful use for really almost any volunteer. There is some training that goes into that. There's a lot of required training. But if you're interested, please reach out and we would love to interview for one of those positions.
And one of the things that you brought up is that, how much does hospice or AMOREM, how much does AMOREM charge for this hospice care?
Yes, so we really want to care for folks whether they have the ability to pay or not. We are primarily Medicare, Medicaid funded. We do take private insurance, but if somebody is uninsured, we don't want that to be a barrier to them receiving care when they need it. And so that is a unique characteristic of our local nonprofit hospice as AMOREM is that we want care to get to people when they need it, regardless of their ability to pay.
Yeah. And so it's low to no cost most of the time.
It's at minimal.
Individual.
Sure, that's right. So for an insured individual, it's really going to be hardly any cost at all. If it is a patient pay type situation or somebody that is uninsured, there's a small daily rate that we are required by Medicare to really post as a cost per patient day, but it is nominal and is also shouldn't serve as a barrier to care or accessing care.
No. Well, Anna, is there anything I've missed?
Well, and I know we have some. Well, I think we can talk about just some of our community impact, and so maybe we can talk a little bit about for the last fiscal year. We wanted to just talk a little bit about how many patients we've cared for and some of the difference we've made in this community. So for last year, we were able to serve 1,470 patients in hospice care.
Wow.
So when you think about that exponentially with families and caregivers and people that are involved, it's really going to be significantly more people that are impacted than just that number there.
Yeah.
We've also cared for 1,880 patients who have received palliative care. So 1,880 patients received palliative care as an upstream service.
Yeah.
We honored 98 veterans with our veterans recognition ceremonies.
And that is so neat because they come and give them a pen and do all that. It's really neat.
It's really kind of a gratitude ceremony. You know, it's our team being able to express their gratitude for that veteran service and sacrifice. And we do that at the veterans have to agree to that. They have to be interested in that. And we include their families and different things. So 98 veterans were honored last year. And speaking to the kind of cost perspective, as a community supported nonprofit hospice, we were able to care for patients we had almost over $1.3 million in care that we delivered without any reimbursement source for members of our community that needed us.
Yeah. And that's what's so great about AMOREM and what they do, and it's just it's so inspiring. But it's like I say, it's a calling. It's a calling almost.
We also have a lot of opportunities. I'll just say this here for recruitment of professionals. We're looking for nurses all the time. We want to have adequate staffing and really robust staffing so we can do the best care possible. And so we have open positions kind of all the time, just like any healthcare organization. And those can also be found on our website too.
Oh, okay, cool.
We have some unique positions that don't come available very often too. So if somebody is a professional interested in learning more about this work as a career option, they should check out our website.
Oh, okay, cool. And there's a lot, especially in Caldwell County, there's a lot of people training in medical stuff at the Caldwell Community College and that stuff. So if you're interested, give them a holler. Look them up online. You
just never know. You never know what might be out there. There's some uniqueness to some of our roles that give you an experience clinically and professionally that you can't replicate in another setting. So it really is robust in that way.
All right. Well, Miss Anna, is there anything I might have missed?
I don't really think so. I think we covered a lot. I think we had a good inaugural talk, but I do think that I've really appreciated the opportunity to be here.
Well, and we appreciate you taking the time to come by and tell us more about AMOREM and also supporting them in this Hospice and Palliative Care Month to talk about that for November. And we don't want you to be a stranger. I mean, we're just down the street. So anytime you want to come on and talk about something. Absolutely. I'll say this kind of in closing, you know, we honor veterans on Veterans Day in November too. Yeah. So we don't want to kind of overshadow that. So we honor our veterans throughout the year, but we want to just recognize that, that Veterans Day is coming up in November too. If you know a veteran, have a veteran in your life, feel like they could benefit from care, we have a really great partnership with the VA services in our area to connect veterans to community-based hospices. So if you have a loved one who's being cared for by the VA, ask that care team if they would benefit from some of our local services too, because we can work really closely with them as a collaboration of care. And in the spirit of giving at this time of year, we do have opportunities for giving all the time, and it helps support our programs and helps really give back to the communities who we value so much the opportunity to take care of. So if you're feeling generous or have donations to contribute, we have a whole team of folks who can connect with you on that. Yeah, if your tax time's coming, and the end of the year, if you want to donate money to AMOREM, that would help.
Sure, it really does. It goes back into our program and really helps us develop new and innovative things that we can do for patients and families to give them the best experience possible.
All right. Well, Miss Anna, I appreciate you taking the time to talk to us and opening our eyes. And we want to appreciate AMOREM in this month of celebrating hospice and palliative care. So thank you.
And the best thing we can do is share information. So if you learned something today, share that with your neighbors and your friends and your family. And it makes everybody really an ambassador of what we can do.
And that number again, if you want to call, is 828-754-0101. Or you can go to amoremsupport.org, and it should be on the bottom of your screen.
Yep, you got it.
All right.
Thank you for having me.
Thank you, Miss Anna. I appreciate it.